So let me turn it over to all of you just for an open discussion. We've got Chief.
Yeah, I mean, like Chief Myers said, everybody said that. I mean, in my small town of Kensington, since the first of the year, we've had 2 heroin arrests already. And we've arrested a mother, 36-year-old with 2 kids in the car. So the other night, we arrested 2 kids at 18, 19-year-olds sitting at the end of someone's driveway shooting up. So we feel it as well. And again, we're not going to arrest our way out of it. But what are we to do? There's no short-term solution for rehabilitation. There's no long-term. And then if we do get them into the program, there's no way to follow up with supervision after that. So, I mean, we're at a tough spot. I mean, we have no place to put them except to arrest them, charge them, and try to get them into jail where they can try to at least sober up and stop breaking into houses. So that's what we're facing. And hopefully with Medicaid dollars, we'll get some of that long-term. But, you know, the drug courts work well, but I mean, we've talked to probation officers on one kid that we had, he came up dirty on 3 piss tests after he's out of probation. When do they violate? You know, he's not working, he's still getting his drugs, so he's out doing something to get the money, you know? So there's gotta be a more comprehensive in the state on what we're doing. And I hate to say this, but it's gotta be a top-down approach. It's gotta be leadership at the top, coming down to focus all our efforts into fighting this problem, because it is a statewide problem. Manchester has intelligence, Hampton has intelligence, everybody has intelligence. My detectives go to the meetings, he comes back with pages of arrests throughout New England. I go through it and I notice there's 2 or 3 other of my residences are arrested out of states. There's no follow through on that. I think that some way we gotta use maybe the fusion center to coordinate all that information and have a more strategic plan on how to deal with things.
Senator, I think, and I've said this a number of times, and hopefully it'll start sticking with it. We know that this problem started through the prescription drug problem. And I think that while there's been a lot of progress, and I'm glad to see that, the results, the numbers of deaths associated with prescription versus illicit drug use, but it's still out there. The drugs like the general spoke about getting 30. I had the same thing in my knee a couple of years ago, 30 pills. Those, you know, if we just combine those, 60 pills, I know I used 4 of them, and he said something about 5 or whatever. There's still 40 pills out there that could be stolen out of my home and some of these other places. We really need the medical community to shut this down and say, we're not going to do it. And I know in Claremont Valley Regional Hospital, they did just that about a month ago. It was in the paper where they said, we started to really look at our opiate prescribing practices and show you now Dartmouth-Hitchcock last week is not prescribing, none of their doctors are prescribing that new drug that can be crushed up. They've stopped it. But we really need to get all of the medical people on board to say, we've got to watch this, because you know, even the officers in our ranks, you know, around the state have been affected by this. And we're going to see more of it. You know, these numbers are going to continue to increase. And when you talk about a 20-year-old that's now fighting heroin addiction, the rest of their lives are going to be affected with it. They're going to be in treatment centers probably for the rest of their life. This isn't something that just goes away. These people carry this on their backs every single day from now on, is what I've been told.
It sounds like, I know we have Dr. Andrew here, but also the medical society piece of it. I don't know what your thoughts are on that.
Just to put an exclamation point on what Dr. Wilkie said, I mean, you saw the deaths. For every single death, for every death, there are 26 who are actually seeking treatment. There are over 100 who are habituated or addicted, and there are 775 who are using and are somewhere along that pipeline. So obviously the death piece is just the tip of the iceberg. The problem with the, and obviously the bang for the buck is in the treatment. It's not on my end. With regard to the medical society, I think we have a lot of conversation in front of us here, because you've got one population of physicians that are absolutely on board with what you say. We've got to really reassess how we're doing this and what we're prescribing. And yeah, I applaud the quote, prescription boycott of this hydrocodone or whatever this zombie stuff is. But there's another very, very vocal subset of physicians who strongly and earnestly believe that pain is undertreated, that pain is the so-called fifth vital sign, and that we should be, if anything, more liberal in our prescribing practices for opiates. Those two groups have to be brought together in a room and hash this one out. Because if they're not talking to each other, nothing's going to happen.
Thank you.